Well, I mean, its core, people-powered health normally is about trying to get people to support each other, the incredible power of mutual groups, but it also means something a bit more micro too, which is building healthcare systems around real human beings and how they respond and what's important to them. And indeed, understanding clinicians themselves to be human beings who have to understand and navigate through some quite difficult choices. So behavioural insights essentially is about trying to introduce a more realistic model of human behaviour into anything that we do. So this is certainly true in relation to health, where we know that by some measures up to 3/4 of years of healthy life lost are from behavioural factors. Diet, smoking, suicide, etc. So if there was any area of policy that screams out to say you should be behaviourally sophisticated, it's certainly health. So it can apply in terms of those big drivers, but it can also apply in relation to aspects of clinical practice, how you give feedback, for example, to patients, or how you enable clinicians to be more effective in what they do. And certainly also how can you harness this capacity of people to help each other. It can range from the very simple, so literally how, if you're going to remind patients so they don't miss appointments, what's the best way of doing that? If you're going to design a site to encourage or help people quit smoking or have a strategy, what's the best way of doing that? So, for example, on the first bit, telling people that, or how much an appointment actually costs the NHS leads to 25% reductions in missed appointments. Or in relation to smoking, we know that certain simplified websites are more effective, or at a more kind of structural policy level. In the UK, we've taken a line which has made e-cigarettes widely available, a controversial position, but we think it's much more effective. It's proved 50% more effective in terms of helping smokers to quit. So it can be very micro, but behavioural can be used in other ways. It can be used around clinicians' own behaviour, so to reduce clinical errors, which is a huge issue. We're about to publish on giving feedback to clinicians about their own medication behaviour for patients, which led to a significant shift. But in relation to some core Nesta style people helping people, there's definitely this fundamental question about how the system can enable people to essentially, you often have a desire to reciprocate and help and support each other. How can we make that easier, more attractive, and harness that incredible power, not just to lead to better clinical outcomes, but to lead to, frankly, a nicer form of healthcare?